Hello and welcome to Good Life, the health show with me, Puja. Well, this is a show that focuses on providing you with solutions to your health-related issues, lifestyle and much more. Well, viewers, there are many different forms of heart diseases. Well, the most common cause of heart disease is narrowing or blockage of the coronary arteries, the blood vessels that supply blood to the heart itself. So if to get in details, we have with us today Dr. Mayank Agarwal, cardiologist from Health City Hospital. So not to waste any more time, I'll straight away move to Dr. Mayank Agarwal, who have just joined in with us. And we will have a fruitful discussion on the topic which we have taken today. All right, thank you so much, Doctor, for joining to Good Life, the health show today. So today the topic which we have taken is a concern by each and every people because the lifestyle is changing for everybody and people are really concerned about their heart. Now, there must be some common heart diseases. So what would we like to start at first?
Thank you, Puja. Yeah, there are different heart problems that we encounter daily. It depends upon the age of presentation. Like the common heart problem which we see in children, there can be congenital, these are called as congenital heart disease. There can be defect in the heart, like they're called as atrial septal defect, or there can be the defect in the ventricle wall, which can be called in the ventricle septum, which is called ventricular septal defect. And there are other rare problems that the children can happen, where there is a heart pumping problem, which we call as cardiomyopathy. Now, from children, if we move to adult, so the most common heart problem which we encounter in adult population is the problem of coronary artery blockage, which you have just mentioned. This is commonly termed as heart attack, or as we cardiologists call it as myocardial infarction. This is the problem which occurs because of the blockage in the coronary artery. There can be sometimes problem in the pumping capacity of the heart, which then the patient presents us with heart failure. Okay. And there can be sometimes problem in the rhythm of the heart, which is called as electrical instability of the heart, which we call as arrhythmias. So in adult, basically, we come across these three types of heart problem. One is the problem in the rhythm, which is called as arrhythmia. Sometimes it can be arrhythmia leading to less heartbeat, in which we need to put a pacemaker in a patient. Sometimes there is a arrhythmia which has a higher heart rates, or tachyarrhythmia, which we call. And other problem, that is a blockage in the heart, which we call as myocardial infarction. And the third most common thing is that the pumping failure, which we call the term as heart failure.
Okay. So these are some of the basic heart diseases.
So these are the most common heart problem that we encounter.
Absolutely. These are most common heart diseases that you cardiologists encounter. Now, if we talk about the notion that is in everybody's mind, that has changed now, Dr. Mayank Agarwal, that the heart disease are mostly seen in male. So is it something?
Yeah, definitely. See, if we see in today's era, there is no much difference in the incidence of heart attack between males and female. See, one of the reason behind the incidence were reported less in female because of the system that we have. That females usually they are occupied in the household work. Their symptoms are not taken into that much consideration. But in today's era, what we have seen that the incidents are almost equal in both male and female. There is no much difference. There are certain things that I would like to highlight. In females, the presentations are atypical in most of the time. Like generally what we see that the heart attack patient comes with a typical central chest pain which is radiating to the arm. But in female, the presentation can be atypical. They may present with epigastric burning sensation associated with vomiting. They may present more with breathlessness rather than chest pain. Okay. So they are usually, for that reason, their diagnoses are usually late as compared to the male patients. But it is not that in 100% cases. In most of the cases, the symptoms are similar. But in minority of the cases, the females are more common to have atypical symptoms.
All right, so typical symptoms for females that we were talking at this point in time. Now, doctor, if we talk about the causes and prevention, we will be coming in that later part. But if we talk about the basic causes of any heart diseases, how will a person know? Now, if a person is having a pain in his chest or her chest, so is it something related to heart, or are we just assuming it?
See, for that we have to, that depends on the type of chest pain. Like just now what I was mentioning is a typical anginal pain or atypical anginal pain, whether the patient has some risk factor. What is the age of the patient? Like a patient is a smoker,
Right.
and if he is having a pain in the chest and that pain is very severe, like it is radiating to the left arm or the upper jaw, then yes, it can be a heart problem.
Okay.
But it's difficult to differentiate, but whenever there is a doubt, it's always better to think it to be a heart problem rather than thinking it to be a gastric problem or muscular pain.
Absolutely.
Because we can lose a patient if we miss a heart attack.
All right, Doctor, we'll come to that conversation, but we have a caller at this point in time. Let's take the call. Hello.
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 Yes,
Okay.
আমি শুনি আছো আপোনাৰ প্ৰশ্নটো কৰিব।
হয় মই আচলতে মোৰ ৱাইফৰ বিষয়ে জানিব বিচাৰিছোঁ। মোৰ ৱাইফৰ ছেকেণ্ড বেবী হৈছে এইকেইদিনতে। তাৰপিছত খুব কোল্ড এনাৰ্জিৰ নিচিনা কোল্ড এনাৰ্জি হোৱাৰ লগতে খুব বেছিকৈ কাহিলে লাহে লাহে ৰেছপিৰেশ্যনৰ অলপ প্ৰব্লেম আহিলে। তাৰপিছত নিউবিলাইজাৰ কৰিবলৈ দিলে। সেই বস্তুটোৱে কি হাৰ্টৰ কিবা হ'ব পাৰে নেকি তেনেকুৱা ধৰণৰ? কাৰণ নিউবিলাইজিং কৰি দিবলগীয়া হৈছে দিনটোত 3বাৰকৈ।
All right.
Actually, I could not get the first part of the question. I got it from the respiration problem was there and nebulization was given.
Absolutely. Doctor,
what is the
Doctor,
age of the patient?
Yes, Doctor, the person is online. You can have a conversation with the viewer.
Hello.
Yeah, can you tell me the age of the patient? Yeah.
হয়, এই মোৰ ৱাইফৰ বেবী প্ৰেগনেন্সি ডেলিভাৰী হৈছে, বেছি দিন হোৱা নাই। তাৰপিছত কোল্ড এলাৰ্জি হ'ল। তাৰপিছত কোল্ড এলাৰ্জি হোৱাৰ পিছততো কাহ হ'ল। কাহ হোৱাৰ পিছত তেওঁৰ ৰেছপিৰেশ্যনৰ অলপ প্ৰব্লেম আহিলে। ৰেছপিৰেশ্যনৰ প্ৰব্লেম আহি যোৱাৰ লগত ডক্টৰৰ লগত কনচাল্ট কৰিলে। তেওঁ নিউবিলাইজিং কৰিবলৈ দিলে। নিউবিলাইজিং ডেইলি 3 টাইমছ হোৱাৰ পিছত অলপ হাৰ্টৰ কিবা প্ৰব্লেম বা এনেকুৱা ইছ্যু হ'ব পাৰে নেকি পিছত?
Okay.
See, that's you want to ask that whether nebulizing 3 times can lead to a heart problem in the future, right?
হয়, ৰাইট।
See, the problem is that nebulization is given for some other reason. I think your patient may have some coronary obstructive pulmonary disease. For that reason, the doctor must have given you nebulization. And as such, coronary COPD or what any lung issue can in future can cause heart disease. There are association, but it is not that 100% we can associate it. There are the chances of those who are having a COPD. There are reported cases, or the data says 25 to 30% chances of those patients can have a heart disease. We have to evaluate the patient based on his symptoms. But it is not that if you nebulize 3 times then he will have a heart problem. That is not true.
All right. Thank you so much for calling at this point in time. And viewers, I would just like to mention that our numbers are flashed on your television screens, and we are having a fruitful discussion on the heart diseases, various heart diseases. We will come up to the causes and also the prevention. So if you have any queries regarding to the topic which we are discussing at this point in time, please call up and ask your questions. The numbers are flashed on your television screens. All right, Doctor, coming back to you again, we were having a talk on the discussion on the causes. The basic causes are all chest pain related to heart diseases. For that, of course, the person has to visit a cardiologist to make out to understand what the pain is all about, isn't it?
Yeah, see, now what I like to focus through this channel is that we should better focus on prevention of heart disease, because prevention is always better than cure. Once you are a heart patient, we always try to treat you, but complete cure is difficult. Even with successful intervention, we have to keep on medication for lifelong. So what we can do for prevention? So those patients who are having diabetes, having high blood pressure, cholesterol issues, obesity, those who have a strong family history of heart disease, these are the patients which are more likely to develop heart problem. And if you compare, if you see in India, then the smokers are one of the most common cause of having a heart disease. So if we have this kind of risk factors, so it is advised to go for periodical checkup. And the best way is to control these risk factors like diabetes, hypertension, cholesterol levels. Then the chances of you getting a heart attack can be reduced to a significant number.
Right. Now, doctor, there is a notion with everybody that unless and until you feel some kind of problem, or unless and until you have some kind of symptoms which you think is creating a problem, so then only you go and visit to cardiologist or any physician. Now, on that note, what would you like to suggest our viewers who are watching our show? If any symptoms or any confusion is arising, you must immediately go and see a cardiologist. What do you have to say?
Yeah, see, the most common symptoms is the chest pain.
Right.
If a patient is having central chest pain, which is radiating to the upper limbs or radiating to the jaw, then it is one of the that the viewers should go to the cardiologist. There are other symptoms, like in a diabetic patient that usually don't have a typical chest pain. They may present with breathlessness. Or there are sometimes a simple thing that if we are able to do some activity, and if you are not able to do that activity, or we get fatigue, or our effort tolerance has decreased, then this is the sign of that you may have a heart trouble. Okay. Suppose if you climb 2 flights of stairs, if you go to 2-story building, and if you get breathless, then this can be one of the symptoms of your heart problem. So this is the time where you have to go to the cardiologist and get checked yourself.
All right, doctor, we will have another conversation on the topic which we have taken, but right now we'll have to go for a break. All right, viewers, we'll slip into a short break, but do come back soon because we have lots more on the other side. Welcome back, viewers. You're still watching A Good Life, the health show with me, Puja, and we are having a fruitful discussion with Dr. Mayank Agarwal, cardiologist from Health City Hospital. Well, doctor, coming back to you again, earlier to the break, we were having a discussion on the prevention part, which is very important. Now, if we talk about the reason of a heart attack nowadays seen mostly in young age as well. So have you gone through some such kind of case in your practice?
Yeah, definitely. See, nowadays the incidence of heart attack we see very commonly in young age population. Okay. And as I was discussing previously, smoking is one of the most important cause, and the other cause which leads to have a heart attack in younger age, what is the stress. Mental stress is, if we see data wise, and it is one of the most important factor. Secondly is the physical inactivity. Now all the youngsters are more in the indoor type of, they prefer indoor games, they prefer more to spend time watching television and in the internet, as compared to what we see in the previous, if you compare 10 years back. So the incidence of heart attacks are definitely is on the rising trend in the younger population. And if we compare them, especially in India, so in Indians we have incidence of heart attack 10 years ahead if you compare it with the Western population. So this is one of the thing which we are really worried, and even there is no surprise if 30 years old guy come with a chest pain, then he may have a heart attack. Like 5-10 years back, if a 30-year-old comes with a chest pain, we think that no, it cannot be. It's very unlikely to be a heart problem. So
what, as hospitals or as doctors, do you think there should be a proper workshop for these youngsters, or a proper workshop for any of the person to have an understanding on what are the do's and don'ts? What do you have to say? A lot of workshops have been held, but as hospitals like Health City or doctors like you, cardiologists like you, what do you suggest? What is your team working on it?
Definitely, by having a workshop, by lots of by this kind of educative program, we can definitely help those patients who to pick up the heart disease at the early stage, later than patient having a heart attack then coming to the hospital. We at Health City are keep on organizing routinely this prevention program, and I think like what we're doing today, like this there should be a frequent program so that the people can watch it and can understand what are the symptoms and what are the risk factors that they have to note, and if anything of them is present, then they should check with their local doctors.
Absolutely. Now, doctors, if we talk about the blood pressure kits or the blood pressure, which is nowadays very handy and can be kept at home and can have a check on a regular basis for the people who are having blood pressure. So, what do you suggest to those viewers or to those patients to have a regular checkup of their blood pressure? If any figures come up and down, you should immediately see a cardiologist or have a video call or a call, isn't it?
Yeah, see, the blood pressure machine which is available at home, which is we say that the electronic BP machine, these are well validated, and these are also recommended by the our international societies, and the values are very much at par as what we get in the hospital or clinic setup. So any person, and what is now the question comes that how frequently we have to check the blood pressure.
Right.
So those who are known case of blood pressure. So for them, regular checkup like weekly or once in a month is done. For those who have a family risk factor and those who do not have a high blood pressure, for that 6 monthly once checkup is sufficient. It's not that every time you have to check your blood pressure, but there are certain ways what we have to note. While checking a blood pressure, you should be idle for 10 minutes. You should not like coming from the outside market and just sit and check the blood pressure. You should relax for 10 minutes. The blood pressure machine should be well calibrated. It should be ideally at the level of your heart, and you should take 3 readings. If you're taking in electronic monitoring with a 2 minutes apart, and you take the average of the BP, the average of the values, and if your average of the values is above 140 or the lower one is above 90, then you should contact the local doctor.
All right. Now, doctor, lifestyle plays a very important role in everybody's life. So what do you suggest to our viewers who are watching our show so that they can have at least a somewhat a proper lifestyle?
See, lifestyle plays a very major role in the prevention of heart disease, not only heart attack, but also for heart failures and all. So what we can do, it is recommended for 30 minutes brisk walking, 5 days in a week. So total of 150 minutes brisk walk in a 7 days over a period of 1 week is recommended. What we can do, we can follow this, and second, we can have lots of vegetables and fruits. Is those patients who are suffering from hypertension, diabetes, they are recommended to have less salt diet, or and those who are having heart failure symptoms, or those who are diagnosed to have a heart failure, they are told to have less water consumption. So these are, I'm telling you, specific points. This may not be valid for every viewers. And for in general, brisk walking 30 minutes, 5 days in a week is sufficient. Eat more fruit, eat more vegetables, and try to avoid monosaturated fats, and less salt should be in the diet.
Right. Now, doctor, if we talk about the patients who are having some kind of problem or some symptoms which have shown to may or may not be they have heart disease, so they visit to your hospital or they visit to any of the cardiologists, what is the first thing, what is the diagnosis part we would like to know?
Pardon?
All right.
Can you repeat?
Yes,
Puja?
yes. My doctor, my question to you was, if any patient comes to you with a minor symptom of having heart disease, which he or she must be thinking. So when they visit cardiologists like you or any hospital, so what is the first thing? What is the diagnosis part? First, you have a checkup. You take out the history of their family. So what is the first thing you do with them?
Yeah, so see, whenever patients visit us, we first take a thorough history.
Right.
What are the risk factors, and what are the his family histories there or not, and then we like to do the basic, the general clinical examination, and later on we do an ECG, and an echocardiography. There are some blood tests which we recommend in few of the patients which we think of. If you are sure that this is when you are not sure that is a cardiac patient or not, whether the heart attack is, whether patient has heart attack is recent onset or the or he had a past heart attack, then we order some blood test like troponin I and CPK-MB, and in some tests where the patients are having a impending symptoms, or we do sometimes test echocardiography or treadmill test. So it depends on person to person which test or which investigation to be done. But basic, every patient, where thorough clinical history and the physical examination tells a lot about the patient.
All right. Now, counseling is also very important these days, doctors, for everybody, whoever comes and visit, be it the patient or the attendant as well. Now, counseling is become a part and parcel of life for every patient, whoever comes. So, what is hospitals and what are the hospitals working on this part on counseling mode? Do you have a team of it to counsel people that the treatments should start at the earliest so that further problems doesn't arise?
Yeah, definitely. We have a team at our Health City Hospital. See, counseling and treatment are two different things. Treatment start as soon as patient reaches the casualty or the emergency. Okay. Because for heart attack, we say time is muscle. So we can't wait till counseling. The emergency life-saving drugs are given, which we call as loading dose to the patient. If suppose a patient comes to the emergency with a heart attack, and counseling starts simultaneously. Like while treating the patients, the treatment goes on, and the doctor on duty, the nurses, they counsel the patient's relative, even the consultant, and it is done in phase-wise manner in every steps, because all things cannot be told in one go. We have to, step-wise it is followed, and there is a protocol, and that is strictly followed.
All right.
And definitely counseling plays a major role in
Absolutely. Counseling plays a major role because some people do also have psychological issues and they think a lot about things. So maybe or might be their heartbeat gets fast. So on that note, a consultation or a counseling is very important, isn't it, doctor?
Yeah.
All right. Now, doctor, who are watching our show, they must be knowing and they must be getting an idea about what we have discussed at this point in time. But doctor, would you like to tell them about the proper way to have a healthy heart and a healthy lifestyle? What would you like to tell our viewers who are watching our show at this point in time?
See, I've already discussed in a few of my talks that healthy heart is very important because prevention is better than cure. And for healthy heart, what we can do is like regular walking, which I told you, brisk walk. We can have in our diet should contains more of fruits and vegetables. Fruits is not allowed for those who are diabetic. For them, special diets are allowed. And second, the thing is that reduce your stress. Become physically more active, stop smoking if you are smoking, tobacco consumption should be stopped, and if you are suffering from any of the risk factor like diabetes, hypertension, get periodic checkup and get it controlled. If your sugars, pressures, cholesterol levels are uncontrolled, then we can reduce the chances of heart attack to a significant extent. So a healthy healthy diet is nothing special but the diet which keeps our heart healthy. Right. So that includes that avoid junk foods, we can have some nuts in our diet, regular diet. Okay. 5 ounces of almonds is good. We can have 2 or 3 pieces of walnut daily. Okay. And like for non-vegetarian, the small fishes, the fish which are small are good. We should avoid too much of red meat. And that's all. And get a regular periodic checkup if you are having a strong family history of heart attack or heart disease, or if you are having a multiple risk factor, which I've already mentioned.
All right. Thank you so much, Doctor, for those lovely words and for those informations. I'm sure the viewers who have watched our show must be benefited with the information you just passed on. Thank you so much, Dr. Mayank Agarwal, for joining to Good Life, the health show today. And viewers, with this, we have come to the end of the show, and we hope that we were able to answer all your queries in the best possible way. And in our next episode, we will be discussing on some other important health issues. So if you have any queries, do join us next Saturday at 3:30 p.m. p.m. live. Till then, stay healthy, stay fit, and keep watching Northeast Live. Goodbye.